This is the first of 3 video lectures on theory-based assessment. In the first video lecture in the series, we're going to explore psychodynamic theory in assessment. Some assessments are consistent with a theoretical approach. We're going to explore 3 assessments that are consistent with the theory. With psychodynamic theory, we're going to look at the adult attachment interview. With cognitive behavioral theory, we're going to look at behavior tracking. And with solution focus theory, we're going to look at the outcomes rating scale and the session rating scale. So, we're going to be exploring in this video lecture psychodynamic theory and the adult attachment interview. The attachment is a nice complement to psychodynamic theory in that, like psychodynamic theory, it asserts that a person's early attachment experiences, the early life experiences, inform subsequent issues and problems that may emerge. Psychodynamic assessment and theory focuses on helping a person develop insight into unconscious motivations and conflicts. Assessment and intervention can look quite similar in psychodynamic assessment. Some of the most common assessments include free association. Believe it or not, that's an assessment of how a client reacts or responds to a variety of stimuli. Transference interpretations, which again require a degree of assessment, if you will, or evaluation in terms of how the client is interacting with you and how that may be based on their past experience. And exploring family of origin through things like the adult attachment interview. The AAI, or Adult Attachment Interview, is a standardized, criterion-referenced interview. What do we mean here? Standardized in that you follow the same questions with every person, though the manner in which you ask follow-ups does vary. Criterion-referenced in that there is a particular scoring method for determining what a person's attachment style is. It is important when you're doing any kind of interviewing, but particularly when you're following a protocol, to maintain a balance of not only following what the directions are, but also being responsive to the client's needs. And as an example, in the adult attachment interview, if a client becomes quite dysregulated, you need to obviously pause and help that client, rather than just push forward with the interview. When you're using a structured protocol, try not to read off questions in a mechanical and rote manner. You can certainly introduce to the client that you're going to be following a script, but still try to read the questions, while you have to read them as they are, in a manner that has some flourishes, for example, some lilt while you're reading. You also want to weave questions into the client's narrative, and this can take practice. So why is the adult attachment interview useful? Why would you even do this in the first place? Well, there's a very important finding, which is adult's attachment style influences their child's attachment style, their development of an attachment style. So in other words, if the adult has a certain attachment style, there is about, I think it's like an 80% concordance rate with the child's attachment style. So not only can you work to help the adult resolve issues from their childhood which may continue to cause them to have certain symptoms. In addition, you're also helping future generations within that family if you can do that. So there are correlations between a child's attachment style and an adult's. Here is the child's attachment style: secure, insecure avoidant, insecure ambivalent, insecure disorganized. You may remember from learning about attachment theory that a secure attachment relationship is the best, is the one that you want ideally. About 60% of people have a secure attachment. Insecure avoidant attachment is when a child will avoid a caregiver, will be closed off to a caregiver. Insecure ambivalent is when a child will cling to a caregiver when they're leaving the room, and when they return, the child will either ignore them completely or will be just very distraught. And insecure disorganized is when the parent leaves the room and the child is so traumatized by the idea of the parent leaving the room that they just stare into space, they may dissociate, for example. So those are the four types of attachment styles in children, and in adults you see open free correlating with secure, dismissive correlating with avoidant, preoccupied correlating with ambivalent, and unresolved correlating with disorganized. So let's look at what each of those attachment styles are in adulthood. First, we're going to look at parenting behavior in regards to relationship type with children. So a child who experiences secure attachment has a parent who is responsive and consistent. A child who has an avoidant attachment style has a parent who is rejecting and distant. A child who has an ambivalent attachment style has a parent who is inconsistent and intrusive. And a parent who has a disorganized attachment style behaves as a parent as frightening, so they do things that are frightening to the child, confusing, they do things that are confusing to the child, and also fearful, meaning the child perceives them as being fearful in how they interact with the child. Next, let's look at how adults make sense of their lives through the adult attachment interview. So again, we're looking at the adult narrative versus child attachment. We've talked about free, secure, dismissing, preoccupied, and unresolved. Let's learn a bit about what those things are. So, if you have someone who has a free attachment style, the kind of adult stories or narrative that you might hear during the adult attachment interview is a flexible narrative, a coherent narrative, a self-reflective narrative, and a balanced perspective. What do we mean by this? Flexible, in that a person is able to adjust to the questions being asked to them. Coherent, in that their answers make sense to us. They seem to begin and end, their answer is moving towards an end place. They don't get distracted, or they don't share something very tangential. They're self-reflective in that they can look back on their past and have wonderings about it. They may even have new insights looking back on their past. And they have a balanced perspective. Things like, for example, my childhood wasn't the best. My parents certainly treated me in ways that I regretted, or ways that I would not have liked. However, there were some positive aspects to my parents. That is a balanced perspective. A dismissing attachment style is an incoherent narrative, meaning it's very hard to follow. It's inflexible, meaning the person isn't able always to adapt to the questions being asked of them. And the person minimizes their emotional experience, and, most notable, they insist on a lack of recall. Meaning you ask a person a question who has a dismissing attachment style, and they'll say things like, I don't remember. What's the next question? Entangled, we also call this preoccupied, is a preoccupation with the past that intrudes on the present. This is known for intense idealization. What do we mean by this? Well, if you ask a person, for example, about what their past relationship is with their family, they'll start talking about their current relationships with their family and their past relationships, and that you'll be unclear as to what the boundaries are between those things. It'll be almost like there aren't these time boundaries in place in the person's mind or in the way they share it, and so you'll be confused about what's really going on, and it'll be hard for you even to remember the question being asked because of all this information being spewed at you in this fairly incoherent way. Unresolved attachment is known for disorganization and disorientation around issues of grief or trauma. So when you ask someone about loss, for example, or whether or not they were abused or neglected as a child, the person will either become very quiet, they may even dissociate. For example, they may stare into space for long periods of time, or they may be just unable to talk about the experience. They may just quietly weep, for example, and be unable to put words to their experience. That's an indication of unresolved trauma. I'd mentioned this key finding in the literature that the AAI profile predicts a child's attachment style, and thus assisting adults to change their childhood narrative can cause improvements in their child's attachment style. So how do we do this? How does the adult attachment interview help a person change their childhood narrative? Well, how it can be used not only as an assessment tool to understand the person's background, but also as an intervention, is just by doing the adult attachment interview, you're kind of pressed or asked to do more self-reflective tasks. And it can kind of introduce the idea that in therapy you're going to be asked to look at your past, talk about it, reflect on it, come to terms with it. That's a large part of psychodynamic theory. That's why it's so well aligned, if you will, the adult attachment interview. So when you're administering the adult attachment interview, you want to focus not only on the story, but on how the person tells the story. You want to know, is the story coherent? Can the person back up their claims with examples from their history? I mean, it's one thing to say you had a great mother, but it's another thing to say I had a great mother and here are examples of why I had a great mother. Okay? You also want to ask or wonder about if the person is self-reflective and open to new insights. Can they make sense of events in their life? You also want to wonder if the person can stay in the room with you rather than getting lost in the details of the story and losing track of the question or of you. It should feel like you're having a conversation with them rather than they're in their own head kind of figuring out. Does that make sense? So by now you've been introduced to the adult attachment interview. When we talk more about this in class, we're going to watch a video that helps explain those 4 attachment styles a little bit more. And then we're also going to role play how to do the adult attachment interview, and you'll get some practice doing it. This concludes this video lecture on the adult attachment interview.